growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi, everyone. Welcome back to the Lionhearted podcast with your host, Dr. Steve Rasner. Well, we're in August of 2021. I'm hoping some of you are on a road to the best year you ever had. And as always, I want to thank you for tuning in each week to get some both clinical gems as well as directional influence as to what you be doing, what you should be doing to maximize this journey that we're both on. So let me give you the title of this week's podcast. We're going to call it, Why Haven't You Taken Any Steps to Get Out of Network? Another way of saying it is, why are you still in network? I know I've talked about this before. Don't turn me off because I have something new. I want to give you a homework assignment. I talked about this before, but I've never said this. Remember I said the first way for you to get out of network is to have a series of meetings, because you can't do it with one 90-minute meeting. It's just not going to happen. But the very first step is to get an Excel spreadsheet. So your homework is for me to send it to you. An example of my Excel spreadsheet. And what you'll see on the vertical column, what you'll see is all the different codes of the procedures we provide. I'm not sure that it's all the codes. And across the horizontal at the top of this spreadsheet, in this particular case, are 1, 2, 3, 4, just 5 different insurances that we used to deal with. And by the way, the reason I'm sending this to you or asking you to request it is out of nowhere. There's so much packed into this early part of this podcast. So this was one of my staff members that sent an email to me and says, can you believe that we used to participate in these insurance programs? I didn't ask her to generate this. She generated it, sent it to me, and said, do you believe that we used to do this? And to be honest with you, it had been a really long time since I analyzed it, because why would I analyze it? I don't have to. I'm not in network. But I did. I looked at it. And I'm just going to rattle off 3 or 4 of these. And if you're driving, if you're in the gym, think about how influential this is to make you take action. So, and by the way, I'm in a rural part of southern New Jersey. So you may be surprised that, well, I think my crown fees are pretty high, which they should be. But a lot of my procedural fees are not that high. So it has here for an exam only, $64. That's my fee. I don't know when this was updated, by the way. It doesn't matter. I want you to hear. So when we were participating, like many of you are, for that $64 fee, the range that we would actually get would go from $27 from MetLife to $37, if you're a network, to a high of $45 with Delta. So our fee was $64. We had a range of $27 to $45 with the 5 companies I'm telling you. Everything else just gets written off. You don't get paid that. Dropping down to a crown. Our crown fee is $1,600. The range of fees that we were paid range from $400 to $826 was the best fee. Let's take the best fee, $826. That was, MetLife. So in that case, we were writing off $800 per crown. How can you run a practice like that? No wonder so many of my colleagues are burned out. An anterior root canal, our fee, this is just the root canal, not the core, $1,232. Our reimbursement range from $398 to $787. I could go on, but I think you get the idea. And not to mention, right? Not to mention that you also have to deal with the downgrades of that insurance company for the procedure that you did. I don't know how many of you will ever do what I try to implore you to do, to begin to get out of network. But you'll never do it if you don't have a starting point. Like, you should get this Excel spreadsheet in your own office. So if you don't know where to begin, or it's just like you got too many things to do, then take mine, and it'll be easy for somebody to duplicate that for you in your office. And then just look at it on a weekend. You probably don't even know. I mean, I only had, at one point, we had 5 insurance companies that we dealt with before we had none. Some of you have 10. You probably don't even know. I would understand that. What you write off. And you've heard me say, you know what happens? You get a big fat check once a week sometime. For us, it was Mondays. And maybe that big fat check is somewhere between $6,000 and, who knows, $10,000. And it feels wonderful on Monday because you're not breaking down what got written off. You're just looking at the $10,000 check and thinking you're rich, right? I'm going to have a good Monday. And the reality of it is you just can't endure long-term like this. No business could. I don't even know how we ended up here, meaning I don't know how my industry got to the point where they were so powerless that they just accepted the fact that 100% of their procedures would be written off to whatever a pencil pusher at a desk for some insurance company, which, by the way, whose CEO is probably making upwards of $3 to $15 million per year, to have his staff deny, write off your claims, downgrade your claims. Doesn't that, as I'm saying that to you, is anybody getting angry? You should. It's really a very unspoken, vile part of our practice at this time in our careers. And I say that to you because back in 1980, which I know sounds ridiculous to some of you, it wasn't as bad. It got really bad in the last 15 years. So you couple that with what happens is that you have an absolute horizontal growth to your net income because you participate in these. It's almost impossible for you to grow except you work your fingers to the bones. Do you understand that one of the virtues of the Lionhearted dentist philosophy is that you get to go into the office each day and not work your fingers to the bones? Think about it for a minute. I know every once in a while, like every 3 seconds, I go off on a tangent because it reminds me why I'm doing these with you. You know, Lionhearted dentist is committed to CE. So he or she has under her belt a lot of procedures that they can provide. By the way, many of which aren't even begin to be covered by insurance. Implant dentistry, grafting. Is your insurance company going to cover the biologic modifier of Gem 21S that you put in your bone graft to maximize bone formation? Are they going to cover the use of PRF, platelet-rich fibrin, so that your soft tissue will heal optimally when you're doing surgery? Or how about Infuse, another biologic, very expensive modifier? There's no way, let alone even an implant. And the problem is that the acceptance of this is so pervasive that the patients are part of the problem now because the dentist created the problem. The dentist's mindset said this is fine, or maybe they didn't say this is fine, but they put up with it. So the patient that was in their chairs just thought this is the way it is. So when they go, by however they end up in your office or mine, and it's a Lionhearted fee-for-service practice, I don't care what you earn, as long as it's enough for you and you're enjoying what we train so hard to do. In every industry, not just dentistry, medicine. Do you know how many physicians, internal medicine physicians, are unhappy with their professional choice? Google it. Google the article, something about, it's called the $1 million mistake. And it's about internal medicine physicians who regret being that because they're paper pushers. I think it's a New York Times article. And they have to see a ridiculous amount of patients just to make whatever they make. And they spend, I can't remember the percentages, but an inordinate amount of time with paperwork. Because really, they're just pawns and puppets of their insurance companies. And I'm here to tell you, I can't speak for physicians. I think there are fee-for-service physicians, and that's what I would be. That's why I'm here. That's why Lionhearted exists. If this is the last podcast ever, which it's not, I brought this to shake some of you up, to get in your head, to make you realize that this is wrong the way most of us do it. No other reason. So you could go to work if you adopted this and provide interesting procedures. My hygienist get an hour and 15 minutes per patient. You think I care about just maximizing productivity and revenue if that was the case? I have extensive time to do whatever procedures I'm doing. I give myself an hour and a half. I know you're going to laugh at this, to do a root canal, an anterior or 2-canal root canal. And I don't do molars because I don't enjoy it and I'm too busy with other things. I know it sounds outlandish, but it gives you an idea how much time I give myself. So I'm not seeing 12 or 20 patients a day. I have side book things for single inserts of crowns and things like this that I have to obviously see. But the main focus of my day is spent with plenty of time to provide optimal dentistry, which even after 40 years, I am fortunate to still enjoy. And I think part of the reason is what I've just said to you. If I had to run in and run out of rooms all day doing mindless work dictated by insurance companies, oh, let me put a crown here. You need to do this and that. Well, I can't do that because my insurance is maxed. I don't know if I would be in dentistry. I wouldn't be. I do know. I wouldn't be in dentistry. Let me continue with this. I brought this to you today because I wanted you to challenge you once again. If you're an associate in an office, you should be listening to this. Unless your long-term goal is to be an associate and nothing else, then I would, look, if you're enjoying what you're doing the way you're doing it, then keep doing it. But if I was an associate and I wasn't enjoying the parameters of my career anymore because of what I was doing, I would try to create a fee-for-service practice within that practice. You're damn right I would. I'd go to my boss and say, this is what I want to do. And I would go out into that community and do everything I could to connect with the community and act as if it was my business, because it is your business, and have patients call that practice seeking you out. If you work as an associate and have a sedation permit and your boss doesn't, aren't they seeking you out anyway? This works even as an associate. It's harder because you're confined by the policies of the office that you work for. But it's not impossible. Nothing is impossible. You better think about that. So let me take you back to a patient that came in last week that not only was out of network, but this patient had I think a DSO, which meant if they went out of network, they received zero. Think about it for a minute. They received zero for whatever work they had done. Not a reduced fee because they went to me. Nothing. That's quite a choice to make, I would think. And guess what? This patient had a treatment plan of close to 20,000. I don't care if it was 5,000. It was lucky that I could make it 20 because I didn't even include posterior replacement at this time. How did that happen? And again, this is just another affirmation that when you listen to these principles, that they work. I know many of you know this. And this patient was 31 years old, came in with her mother, and had a history of many bad experiences. So the first thing that got her, and she was not close, she was from another state. So that meant there's a challenge right there. She had to take time off. She had a good job. She had fear, so she came with her mother. So there's two people that have to be able to make that appointment. So they came in. And of course, the huge challenge at some point in this conversation was going to be, you're not going to get any reimbursement. Actually, she knew that before she stepped foot in the office. So I guess she was there to see how impressed she might or may not be with us, with me. But she came in and went through the same channels that you always hear me talk about. And she had serious need and had really bad experiences. Her needs included multiple root canals, multiple crowns. She was a very pretty girl with a pretty unaesthetic smile. A lot of facial surface caries, that kind of a patient. Missing teeth in the posterior. This was a challenging case that we're going to attempt to do in phases. And quite honestly, I've already started it with success. And, we're on our way. So the biggest thing I had going for me is that I offered sedation. By the way, I tell you a side point really interesting about this patient. She noted to us that even IV sedation was challenging on her. But she gave me one lead-in that made me think it might or may not be doable, and that is that she liked and reacted well to nitrous oxide. Can you imagine? She somehow was resistant to IV sedation and to the whatever, I don't know if they use propofol. I really find that hard to believe that I didn't ask. But she said she had some success with nitrous oxide. So that made me feel that my oral sedation concoction, which includes nitrous oxide, may very well work. And I told them that if it doesn't work, that their money's refundable and that I'll do my best to help them find a doctor that could treat her. But it did work. So that's the biggest thing I had. But, if she came in and I only had sedation and I had no chairside charm and no chairside compassion, because I really do, like many of you, have a tremendous interest in having this girl succeed. She's a beautiful girl that is handicapped by her smile. And, she's young enough that she has no perio. She just has restorative issues. And we left, as I said to you, she has so many issues that her treatment plan was enormous, even though it doesn't include molar replacement. She has a couple molars missing. I believe there are a couple implants to replace premolars. See, when that happens, you got to go through the whole thing. Phase 1, in her case, it was multiple root canals. Phase 2, implant placement, because we want to get that out of the way because I need 16 weeks for integration before I'm going to load anything. So all kinds of plates I have to spin, and plus get confidence in this patient who had such a track record of failure with other dentists. And that all happened. And it happened in one visit. So remember how I started this podcast? I talked about why he's still in network. At least when they're in most networks and they decide to give you a try, they just get less money than they would have gotten by going to an in-network dentist. But this was the extreme. She received no funds by choosing to come to us. That's, to me, a fairly good story of success of Lionhearted principles, how far they can go. Doesn't always work, but it certainly worked, in this particular case. So the takeaway for this week is You really owe it to yourself. Even those of you in associateships, those of you in dental school, somehow, even you request it, or Google on your own, the write-offs that are given. Now, you would have to know what normal fees are, but insurance networks are out there waiting to downgrade your services and write off what they will allow for fees. There's got to be something in me saying that to you that influences you biologically, physiologically. It even angers me as I'm saying it to you right now, and I'm not even a network. It angers me that my colleagues allow themselves to be punished. For what reason? Because you're not a good dentist? That's why they're doing that? Why their CEO gets, every single time, you look up the CEO reimbursement of MetLife, Delta, Cigna, Horizon Blue Cross, every single one are multi-millionaires. Why they downgrade, why they maintain our maximums and don't increase their maximum. You know what the maximum should be of my generation based on cost of living from 1980 to now? The maximum in dental insurance should be $17,000. Somebody did a study on it compared to the rest of the cost of living. But it's not. It's not $17,000. It's $1,200 in most cases, sometimes $1,500. And it was $1,000 in 1980. I mean, every way you look at this, it's bad. And I'm trying to get you to realize through the Lionhearted philosophy what a great journey this can still be. And you have all the time in the world. You do. I don't care if you've been in it and you're 45 years old. It's time to change. Anyway, I hope you write to me. I hope this helps some of you. Stay strong, stay focused. I'll see you next week on The Lionhearted Dentist.